So today we have Dr. Eberly joining us to talk about the knee and its functions. Thank you for joining us.
Lonnie, it's a pleasure.
And so what can you tell us about this fascinating joint?
Well, you know, it's an industry in Bend. We break them over on the west, and we put them back together over on the east side of town. So it's a very important part of the body for Bend, Oregon. Of course, talking about ski injuries on Mount Bachelor often involve knees, and we have some wonderful orthopedic surgeons in Bend that can help people recover. But it's really kind of simple. There's two bones that are the most important involved, so let me put them together. The femur bone, of course, and that's where we go into the hip. And then the bone below that is the tibia. And that joint right there is the knee joint. So basically, we need to hold these two bones together, and we need to let the tibia do that.
So what holds them together?
Ligaments. Ligaments are what hold our bones together. And the knee's got 4 major ligaments. Here's a model, and you can see a ligament right here, and there's another ligament right here. And these 2 ligaments are on the 2 sides. So we call those collateral ligaments. You know, if you go get a mortgage, you have to put up collateral. And that means both sides. So, you know, you get the bank's money, but if you don't pay it back, the bank gets your house. So collateral, both sides. Yeah. So when you're looking at knees and you want to figure out, well, which is the right one and which is the left one, a really good way to do that is to look for this smaller bone of the lower leg. It's called the fibula. You know, you see that in the drumstick? You know, that little one that you peel off? Yeah, the big, well, actually it's, yeah, the big one is the tibia, and the smaller one is the fibula.
Is the fibula?
Always on the side, so I know that this is the side here, so I know this has got to be the right knee. So I know that this right here, this ligament, is the lateral collateral.
The lateral collateral?
Isn't that fun to say? Lateral collateral. Love that. And then the one over here is the medial collateral.
So the medial collateral?
Yeah. And their job is to keep the lower leg from swaying back and forth. So I'm going to try to sway it back and forth, but the collaterals are stopping me from doing that.
So are your ligaments stretchy at all?
Oh, not very much, right? Because if they were stretchy, our joints would come right apart. It'd be like rubber bands. And what we need instead is real strong rope to hold those bones together. Not much stretch to them. Let me show you another model real quick. I know it doesn't look like a knee, but let's use our imagination. This is the Home Depot knee. This represents the femur, the upper bone, and this represents the lower leg. And right here is the lateral collateral ligament, this yellow one. And it happens to be set up so we can take it off. So let's take off the lateral collateral. And let's see what we can do with that lower leg now. See what we can do with it? Oh, look how we can sway that over to the medial side.
So would that then help someone like a doctor to diagnose
Exactly.
which ligaments
So
you've
if
torn?
somebody has torn the lateral collateral, then that lower leg is going to sway to the inside.
Okay.
If I put it back, you see I can't do that very much. The 2 collaterals stop me from swaying it. Let me take it off again, and you can see how it, yeah, now you can really sway that lower leg to the side.
Wow.
Ooh! And then what about the other one? Let's see the other one. This has got the medial collateral here. That's the red one. And if we take that one out, can you guess?
But probably swing
Exactly. It'll sway out
outside.
to the side. So here you can see without the medial collateral, we can take that lower leg and sway it to the side. Let's put it back. And now we can't do that. See how the collaterals
Mm-hmm.
keep it from swaying back and forth?
So does that then help with our stability? Otherwise,
Oh,
we just
absolutely.
collapse.
Oh, we'd be in big trouble if we didn't have the collaterals. That's two of them.
And so what are the other two?
The other two are harder to see because they're crossing right in the middle of the knee. And because they're crossing, we call them the cruciates.
Cruciates.
The cruciates, as in crucify, crucifix, cross.
Mm-hmm.
Yeah. The one in the front, pull this out of the way here. The one in the front, you can see it right here. That's called the anterior cruciate. And it comes off the anterior side of the lower leg. Yeah, so that's the anterior cruciate. And then if we take a look at the back side of the knee, right back here is the posterior cruciate. It's a little hard to see, but they're crossing each other in the middle of the knee. So you want to see the sticks? We've got some stick models for the cruciates.
Okay.
So we have the anterior cruciate here. That's the blue one.
Mm-hmm.
We call it the anterior because it's attached to the front of the lower leg.
Okay.
And let's see how they work. I'm going to try to move this lower leg back and forth. And I can't do that because the cruciates won't let me. Now let's take the anterior cruciate ligament out. We're just going to detach it. And let's see what can happen. Oh, watch this. Woo! Look at that. See how that just comes right on out? My anatomy instructor had a torn ACL, anterior cruciate, and he, in class, he'd get up and he'd put his thumbs behind his knee, and he was able to roll his lower leg out about 1.5 inches. Oh, it was great. I wish I could do that. Almost makes me want to have a torn anterior cruciate. So you can see how people are in big trouble if they have a torn ACL, right? Yeah, then the lower leg just does that.
Did he have to wear any sort of a brace?
You know, he just built up his leg strength. He climbed mountains. He did all kinds of things with that knee. It was pretty amazing. You want to see the other one?
Mm-hmm.
Okay.
So this is the posterior?
This is the posterior cruciate. It attaches to the posterior side of the lower leg. And again, when it's there, you see I can't move that lower leg back and forth. The cruciate stopped me. Now I'm going to take off the posterior cruciate. There, it comes off there. Can you guess which way we'll be able to move the leg now?
So now you'll be able to move it back.
Oh, you're right. Look at that. Whoa, look at that. See how that? Oh. So that's not good.
So are ligaments something that can be repaired surgically?
Well, yes, indeed. And there are many people in Bend who have had them repaired. But actually, more likely, they're replaced. Because ligaments are very, very slow to heal on their own. And so if it's completely torn, then that patient's going to need to have a replacement. So typically what they'll do is the orthopedic surgeon will take a tendon from the back of the leg, strip it out, and use it as a substitute ligament.
A tendon substituting as a ligament?
Yeah.
So are they made of similar material?
They are kinda, although the tendon is a little weaker, so what the surgeon will do is take the tendon and double it back and forth. So actually it's maybe 3 or 4 loops of that tendon that's taking the place of that one missing ligament. And over time, the neat thing is the tendon will change its properties so it will become a ligament.
That's fascinating.
Yeah. Well, they do lose one of the smaller muscles from the back of the thigh. That's the price you pay for that. But you get a working knee out of it. Yeah.
And what is the function of this bone right here, the patella?
Oh, yeah. Isn't that an interesting bone? The kneecap, the patella, you can see it right there. And it's underneath this big tendon. This is a huge tendon that's coming from the big thigh muscles. We call them the quadriceps. And the quadriceps straighten the knee. So when we're standing up from a crouch, it's the quadricep muscles that are straightening our knees when we do that. Very powerful muscles. So let me kind of illustrate for you. It'll work better if I can take this base off. Is that all right if I
Sure.
do that? Okay, take that off real quick. So when we're walking or standing up, it's my hands, the quadriceps. See how they straighten the knee?
Mm-hmm.
Well, when you look at the front of the knee, you can see a groove.
Mm-hmm.
And it's in the femur, and that groove is where this patella is supposed to rest as it slides up and down. Of course, we do that a lot, right? Every step we take, the patella is sliding up and down. Yeah. So I'm getting to your question, though. You're asking, well, what's it for?
Mm-hmm.
Okay, so here's a way to think about it. When you want to go up a steep hill on your bicycle, you might use your derailleur to loop your chain over a bigger sprocket on the rear wheel. And suddenly, it's a lot easier to climb the hill, right? You get a mechanical advantage.
Okay.
So notice how, if you pretend this tendon is the chain of your bicycle, notice how having it go over that bone is like having it go over a bigger
A big
sprocket
sprocket.
on your rear wheel. And it increases the strength of your lower leg by about 25%. It makes a big difference. Yeah,
Such a little.
yeah. Hey, I got a model. You might want to try it.
Okay.
It's kind of a fun way to see what the kneecap does for us. Lonnie, would you like to try this model?
Sure.
It's a model of what the kneecap does for us. So here is the tendon from the quadricep muscle, if you could pretend that. So you're actually going to be the quadricep muscle in a moment. And right now we have this tendon looping over the top of the patella. And that's the way it works in life, in the real knee. So go ahead and be the quadricep and just kind of get a sense of how hard you have to pull, how hard that muscle has to work to get that lower leg to swing up. You can kind of get a feel for it. All
Yeah, it
right.
seems pretty
Easy. Well, let's take the patella out. We're going to loop the string here so it's not going over the patella. So go ahead and try it now. See if it makes a difference.
That takes a lot more effort.
Yeah, it's going to be harder to
And
do.
it's not as smooth, and I don't feel like I have as much control.
Yeah, so let's put the patella back in. You can try it one more time with the patella.
Much
A lot
better.
easier. Yeah, it's amazing, isn't it? So it's a clever trick that Mother Nature did in our knee to give us a stronger leg just by using some leverage.
That's incredible.
So, you know, that poor patella, though, it can take a real beating. And that gets us to a problem called runner's knee. So normally when we run, this is going on, right? And as long as that patella is going straight up and down in the groove there, then there's no problem. Unfortunately, when we get stronger quadricep muscles from running or biking, typically it's the lateral quadriceps, the side part, that gets stronger. And because of that, the patella may get dragged off to the side. And when it gets dragged off to the side, the back of that patella is scraping against this ridge in the femur. And that just pounds the poor patella. And it gets soft and it gets sore. Yeah, it's called chondromalacia patellae in medical speak.
Chondromalacia patellae.
Patellae, yeah. It means soft cartilage in the back of the patella. But it's runner's knee. And it really, really hurts. A lot of people have that, and the best way to try to solve it is to make the muscles on the inner side of the quadriceps get equally strong. And if we can match the strength on the two sides, then the problem's solved. Then the patella will glide up and down. Or sometimes people will get something like this, and they'll wrap it below the knee, and its job is to keep the patella in place.
Huh. And so that's
So that
just a
might help
simple
too.
band that you would put?
Yeah, yeah.
Wow.
Sometimes that's quite helpful for people who have this problem.
Interesting. So are there any other problems or injuries that you can get to your knee?
Oh yeah, maybe one of the most common, especially for football players, is the torn cartilage. Also skiers can have problem with this too. So let's take a look at what people are thinking about when they have problem with their cartilage. What they're thinking about is a pair of little cups on top of the tibia, and these little cups are called meniscues, and they make a socket for the femur to fit into. Because notice that the bottom of the femur has got knobs, but the top of the tibia is fairly
Loose,
flat.
flat.
Isn't that odd? So in order for this to work better, nature made these little cartilage cups for the knobs of the femur to fit into.
Wow.
And that's well and good. But notice that the inner edge of the cup is very thin. If I peel it up, you might be able to see how thin that is. So if somebody pounds that, it's very possible to tear that inner edge. And that's the torn cartilage. It's a torn meniscus. The classic problem that can happen, let's grab one of these stick ones, is the knee locks up. Suddenly, the knee just won't bend. It's locked up. And it's kind of like taking a doorstop and sticking it in like that. And notice how now it's locked up? So that torn piece of cartilage jams in between the two bones, just like this doorstop is doing between our two pieces of wood here. And that jams the joint. And it's going to be locked up until that piece gets out, and then it can function again.
So how would they trim it, or how would
Yeah. So the orthopedic surgeon can go in there and shave that thin inner edge, try to get a smooth edge off of it. Of course, the problem is you're losing some of that cup. And yeah, that can cause a little problem of its own, but most times it's much better than having the frayed edge getting in between the two bones.
And so has that had any impact on the design of things like artificial knees?
Oh, absolutely. You know, when artificial knees were first developed, people thought it's just a hinge joint. And you kind of look at the movement of the knee, yeah, that's like a hinge in a door. But then they discovered, because their patients were falling over, they discovered that there's actually more to the knee. When we walk, the upper leg is actually sliding backwards and forwards a little bit on top of the lower leg at the same time as we're getting the hinge motion. And that sliding back and forth is very important for our body to keep its balance so we don't fall over. And so Mother Nature had to build in a way for the upper leg to slide back and forward a little bit with each step that we took. And these cartilage cups, these meniscuses, are the way to do that. So, you know, at first you might think, wow, Mother Nature should have just made the two bones fit together better and not have to jury-rig a pair of cartilage cups. But actually it's there for a reason. It's there to allow that movement back and forth in the joint.
And so is it possible to get something like bursitis in your knee?
Oh, you bet.
And what causes
You know,
that?
what are bursae? Well, they're little bags. They sound like, bursa sounds like purse, doesn't it? Yeah? So the same word from Latin, purse, burse. So little bags of lubricant. And they're sandwiched in all around the knee so that the outside parts, the tendons and so forth, can move back and forth without causing any friction. Of course, if we overuse the bursae, you know, if we pound them too much, they get very sore, and that's bursitis. Yeah, so definitely possible to get bursitis of the knee. And then the other big problem, besides, you know, athletes tearing the ligaments, the other big problem is the loss of the cartilage. Let's see, this model has some cartilage, if I take it apart a bit. So lining both of the bones is a very smooth cartilage. And it's great for a joint because it's glassy smooth. But unfortunately, it doesn't heal very well at all. And we can wear it down with overuse. And that's probably the main reason why the knee ultimately has to be replaced in some people. They've lost this cartilage covering, and now it's bone rubbing against bone. And that's very painful. And it doesn't work very well, and after a while the bones will actually start growing together. So at that point, you need a new knee. And orthopedic surgeons can do that.
So when bone rubs against bone, it actually tends to fuse
It may
together?
fuse together, yeah. One of the jobs that cartilage has is to keep the bones separate. Otherwise, they want to grow together.
Interesting.
It's a interesting joint, but it wasn't that complicated, was it?
No, actually, it's...
I mean, you know, you can do pretty
Very
much
well designed.
everything with something as simple as this.
So now you can go out and construct your own.
Yeah, you can build
Hardware.
a knee at Home Depot. But more importantly, you can understand it. So if you happen to have knee problems, you know what's going on. You can understand your knee better. It's not that hard to do.
Super. Well, thank you so much, Dr. Eberle, for your time. This
Oh,
has been absolutely fascinating, learning more about the knee, and we look forward to discovering more about our anatomy and physiology in future episodes.
Oh, it's a lot of fun, Lonnie. Thank you.
Thank you.